Good morning. Today, we would like to present an investigation letter about the awareness of comorbidities associated with atopic dermatitis in adults, presented by Aizpurúa and Sashira Córdoba. We would like to submit an original research article entitled American Academy of Dermatology Guidelines, Awareness of Comorbidities Associated with Atopic Dermatitis in Adults, for your consideration. We confirm that this work is original and has not been published elsewhere, nor is it being considered for publication elsewhere. The objective of this guideline is to phrase the evidence for the association between atopic dermatitis and comorbid conditions, with the aim of improving awareness and understanding among dermatologists and other clinicians. The target population of this guideline includes adults aged 18 years old and older with atopic dermatitis of any severity in any healthcare context or setting. In short words, atopic dermatitis is a chronic inflammatory pruritic skin disease that is often associated with a history of allergic rhinitis and asthma. This study is important because atopic dermatitis is a condition that affects the quality of life and the health system utilization. Analysis of the evidence includes resulted in 32 statements, including clear evidence of the association of atopic dermatitis in adults and allergic conditions, atopic conditions, and bone health conditions and skin infection conditions were identified. There is some evidence supporting an association between atopic dermatitis and substance use, attention deficit hypersensitivity disorder, and elements of metabolic syndrome. Also, there is also evidence suggesting that there is a small association with various cardiovascular conditions. Methodology. Okay. Our multidisciplinary work group conducted a systemic review of the evidence of the association between atopic dermatitis and selected comorbid conditions, and employed the grading of recommendations, assessment, development, and evaluation for prognosis approach to assessing the certainty of the evidence. The work group drafted statements regarding the association between atopic dermatitis and comorbidities based on the evidence and by considering the following: the strength of the estimated association between atopic dermatitis and a selected comorbid condition, and the overall certainty of the evidence.
2. Conclusions and results. Results. Analysis of the evidence resulted in 32 statements. Clear evidence of the association of AD in adults and select allergic atopic, immune-mediated mental health and bone health condition and skin infection was identified. There is some evidence supporting an association between AD and substance use, attention deficit hyperactivity disorder, and elements of metabolic syndrome. Evidence suggests a small association with various cardiovascular conditions. The association between AD in adults and autism spectrum disorder, myocardial infarction, a stroke, and metabolic syndrome is all inconclusive. Well, we can see results and two pictures about cardiovascular condition and staph infection, skin-related symptoms. Next, we can see a patient education of conclusion, patient education, dermatologist role, and comorbidities. In the management of and shared decision making for AD should incorporate awareness and consideration of comorbidities, discussing the relationship of various comorbidities with AKIM can empower patients to better understand their skin condition and overall health and enable them to make treatment decisions that are best for them. Dermatologists can play an active role in improving the overall health and health-related